very, very clear. And not only that, if you want to explain the patient or counseling the patient, you need to know where exactly the patient is lying and what is the treatment protocol that you are offering to the patient. And this decides how many days he is going to survive. Because the overall survival itself is 5 year survival is very, very less. It comes in the 30 to 40%, or even in the best hands in Japan, it is only 50%. So, as you know, the presentation is very rare, but these are the symptoms like dyspepsia, bloating, early settling, as Sir said, these are early symptoms where we can catch up the patient. Most of the times, patient will take tablets or on counter drugs like pantoprazole, all these things. So he will delay his own presentation by taking his own medication in the counter. That delays that is the period where one can have a better treatment. So lack of education is also one of the reasons for this late presentation. So also the hematemesis, weight loss, loss of appetite are the other common presenting symptoms. Whenever these patients are come to you, they are always suggest Purgy endoscopy. Not only not only a diagnostic, if we add an ultrasound, it suddenly becomes stages and it suddenly becomes a therapeutic option even. So these are very late signs. This is for only for the diagnosis. Nothing more can be bring out of them. These are 5 years survival rates. If you observe carefully, the moment lymph nodes are involved in the regional, that it almost half the survival is suddenly becomes half. It is around 75%. Once the lymph nodes are involved, within 36. Once it goes to the metastasis, like the liver is very nearby and very happy to go there. The moment it reaches the liver, the survival rate suddenly falls to 7%. So early catching the case early is the key to offer a better curative treatment. So once you suspect and you start making a diagnosis, how you make a diagnosis means it's by the upper G endoscopy, and you suspect when you suspect a lesion, so immediately you have to take a biopsy. So most of the times, if you take 1 or 2 bites, you may miss the diagnosis. So that is why it is clearly advised that minimum of 6 to 8 bites are necessary to see the proper histology, what is going in the tissues. Very important. So next comes the endoscopy. Once you make a diagnosis, so